cool test that we can do like around 8 weeks postpartum that actually gives us a little more information about the risk factors or the prediction that somebody is going to develop prolapse. And it's really easy to do, but to be honest, most of my patients have never had it done. And what we're checking here is called the genital hiatus measurement. And what the genital hiatus is it is the measurement at the vaginal entrance that goes from the urethral meatus, or basically just the urethral opening, to the very bottom of the vaginal entrance. And we measure that when the patient is bearing down or straining. And we see basically how much length or how much space is created in that area when they bear down. And what this study showed us is that people who had greater than 4 centimeters at their genital hiatus, or again, that distance between the urethra and the bottom of the vaginal entrance, when that distance was more than 4 centimeters, they were about 3.3 times more likely to have developed prolapse at 1 year than people who had less than 4 centimeters. This doesn't mean that everybody who had that developed prolapse. It was about 16% of the people who had greater than 4 centimeters developed prolapse at 1 year versus about 5% of people who did not have greater than 4 centimeters who developed prolapse at 1 year. So it just made them about 3.3 times more likely. Also be helpful for reassuring people, because if somebody comes in and their genital hiatus measurement is less than 4 centimeters, they are much less likely to be developing prolapse at 1 year. So I can tell people, hey, your measurement here is pretty small. Your risk of developing prolapse is fairly low. Interesting thing about the study is that they did exclude people with hypermobility disorders like Marfan's or hypermobile Ehlers-Danlos syndrome. And we do know that hypermobility disorders can put people at a higher risk for developing prolapse as well. I think it's important that we screen for these kind of things, because if somebody knows that they're maybe at a higher risk for prolapse, and this is one of multiple things that puts them at a higher risk for prolapse, like say they also have a family history, say they also have a hypermobility disorder, then we can take a look at what activities are you doing, what are the types of things that we can maybe adjust to make it so that you are less at risk, or what are some ways that we can maybe mitigate that risk down the road.